chase. 405 is the freeway. Slinging my banging, my swinging, my coup. DeVille, scoop, DeVille.
Hello, I'm Dr. V. Welcome to Neutral Voices. And this is In Depth, where we dig deep in the trenches of what matters. They throwing me off. I thought somebody was getting ready to tell me to do something, and all I want to do is open this card. Can we start like that?
It's your day.
I'm just kidding. Happy birthday.
Happy birthday, Dr. V.
And you know when it's your birthday and you get to be a certain age, over 50, you can do what you want to do for real. So I just want y'all to know we about to flip the script in here.
Okay.
So guess what we talking about
Let's
tonight?
do it.
What are we talking about tonight?
Party.
I don't have my notes.
I wish we could, but we got to stick to the script. And tonight, thank you for joining us. We are actually talking about men cancer. It makes sense because we've been talking about the different types of cancer all month. So if you have missed any of those episodes and you want to search them out on YouTube.
Yes.
Anyway, so men and cancer. There's a lot of different ones. We've already covered some. So let's talk about the most common and then get into some of the ones that we have not talked about.
Yeah. Well, the most common we've reviewed the most common is prostate cancer, and colon cancer. But for men, they say colorectal cancer because as we said, there are two houses on the same block, but they're not the same, but they're so closely related that those are, two of the most common. Right. But also, another most common is in the male region is testicular cancer. 1 in 250 men will develop testicular cancer, and if you know Lance Armstrong, he had a couple of bouts with that, and you were talking about that. And then lung cancer really affects men more than it does women. And then urethral cancer. Women can get it too, but it affects men a lot more. Urethral cancer is another one that affects men.
Would
a lot
that
more than
one
they
be
do
connected,
women.
or maybe not? I was thinking bladder.
No, bladder cancer is another one that that affects. But urethral is the shaft in which it's inside the penis, and I can't say it any other cleaner way.
Well, we'll keep it straight because that's the only way we can. That's how come I was saying I didn't know if it was connected to the bladder cancer because of that. So
I was trying to think of a.
No, we just gonna keep it real. Okay. Listen, this is Neutral Voices. We believe in helping our community, and we just gotta say it like it is.
It is, but the urethra is the shaft, the inner shaft of the penis, and that's where they can develop cancer in there.
You know what? And we talked about some of the cancers being painful. And, just you saying that, to me, I would think that all cancers, skin cancer, etc., bladder, whatever, it just all seems like it's painful. But I would say outside of my uncle, I don't really know anybody that I had a conversation with to ask that question. Right. Do you guys know if, the other ones are painful? I know with him having the colon cancer, he said it was very painful.
I haven't. So when I was younger, I remember my uncle, because we had to go to the hospital. My uncle was probably, I would say, in his maybe late 40s, early 50s. And he was like an avid person who his lawn was like immaculate. He was always outside. He was a man's, he was a manly man. So he was actually the GM at one of the halls in town. So he was like a very busy man. Well, he started to get back pain, and he ignored it for a while because he was outside all the time and mowing. It got so bad that finally he went to the ER, just thinking he had pulled something. That was the only symptom that he had. Long story short, after some testing and everything else, he had, I think it was remember what stage it was when it was found, but it was lung cancer, and it had already moved all the way throughout, and that is where, so by the time the pain started and got super bad, it was already
far gone. Yes.
And he passed not too long. I mean, probably, I would say less than a month after it was found. And this is a man who was always outside, who was always healthy, always doing everything, and just overlooked it because we get pain sometimes.
Exactly. Yeah, I think that's the strangest part, and that's the scary part, to me, is just having the pain, and you have pain like you said, all the time, different pains. So it's you really don't know when it's like time to get to the doctor.
And when they said
for real.
cancer, because I remember, like I said, I was young. I remember like my mom and my aunt, everybody just being like, "What?" Like it wasn't even on the radar, you know, when he was in there. So
Yeah. Now the pain, and I just freshly over the weekend we memorialized my cousin's wife, and she went through 3 stages of cancers and 3 bouts of cancer, and the last one was the most painful, as I remember her saying, and that really, you know, because the last was stomach cancer, and you know, and it was just very painful. But I hear. And, you know, to see somebody just, you know, and I said that to you, it's really hard. I've never been directly in contact to watch somebody go through those phases, but seeing people that's with people go through that, and it's hard on those people as well.
That's right.
And just to hear that, and you know, the pain and everything that she went through, it was just, you know, I can't imagine how painful it is from the treatments, and just it's an inner thing that you just can't get, you know. So yeah.
Yeah, so, you know, and just thinking about the pain, so there's another side to cancer. So we know there's the different stages, as Jill mentioned, but I'll say there's some extreme situations connected to people, even when they find out that they have cancer. Which is a hard thing to hear your doctor say. And so when you think of the extreme situations, what comes to mind outside of just thinking about the emotional well-being of that person and how they are affected? That's how come I think some people don't share it with their family.
right.
And before Jill go in, and I because talking to Mr. Ayers, and can I plug this once again?
Yes.
Men, every second Wednesday of the month, please, Mr. Ayers has a great seminar, event, support group, whatever you want to call it. It's at the Impact Center on Paulding, right off of Hezekiah. If you know where, what's Pastor Luther's church name? It's slipping my mind. New Covenant. It's right on the New Covenant campus. Go. He gives you a lot of information. And one of the things we were talking about, and I know, Jill, one of the extremes is that we as men, we hide it. We don't want, you know, the people around us to really know at first. A lot of us, you know, because we, like Jill said, her uncle, was it your uncle? We want to be those manly men. We want to still function the way that we do. So we don't tell people right off. We hide it. You know, it's like a shame sometimes. I know it's getting better, but you know, a lot of men don't want to, you know, open up and tell them, and then they let it go. It gets too late, and you know. But Mr. Ayers said that, you know, you shouldn't go to those extremes, because your partner, if you have a partner, they should be able to know and go through it with you. If you have a family, they should be able to know and go through it with you, because, you know, it hurts them as much as it hurts you. So I think the extreme is we hide it. We don't talk about it.
Right.
Yeah. And, you know, you bring up Mr. Ayers' event, and really any kind of event or support group, because not only are these, you know, gentlemen and women getting education, but it also can serve as a form of support. And that is so important, because here's an interesting number. So out of 8.5 million cancer patients, almost 14,000 of those committed suicide during their diagnosis. 83% of those were men. 83%. Were men. First of all, that number, almost 14,000 people, is huge. But then to know that 83% of them were men. So also, you have to think of it, it also causes, it almost attacks the masculinity of a man.
Right.
Because not only are you all of a sudden no longer the provider or the breadwinner, the gender roles switch. That is very hard for a man. I mean, it's hard for anyone, but as a man to give that up, we don't think about that. We don't think about how a diagnosis like this can attack the masculinity of a man.
And that's another thing, is because as you think, a lot of the men cancers, you know, do, and women as well, because they have uterine cancer, they have, you know, ovarian cancer. But when it attacks the reproduction system or organs, you know, he was talking about men, you know, that again, they don't feel manly. You know, he said, you know, there was a gentleman there, and he was talking about, well, I'm still a man, and I'm trying to clean it up as best as I can, because it was man conversation. Well, he was saying he could still get an erection, and he could still, you know, he could have relationships with his wife, but he was going through prostate cancer. But
let's be clear. He can still have sexual intercourse with his wife, so he wasn't affected sexually in that way at all.
As of yet. But Mr. Ayers was saying, and he was telling, you know, we deem that, you know, I don't know about how women, but in the men's society, it's we deem that's our virility. That's how we, you know. So when that fades, that plays with your mental, you know. And Mr. Ayers was talking about this, you know. So you get depressed because you're not the man that you thought you were. You get depressed because you can't do the things that you used to do. And with prostate cancer, testicular cancer, urethral cancer, those mess with, you know, your male genitalia, and some men it messes with their manhood, their mind, because that's how it's connected. But Mr. Ayers said that, you know, you, and Dr. Coates as well, that he was fine now, but you got to prepare for what's coming up the road. And a lot of us don't prepare for what's coming up the road, and that's what, with the shame and everything. And then when it hits us, the reality hits us, we're not right there to deal with it. You know, it messes with us mentally, it messes with us emotionally, because we haven't prepared. And
so when you say prepare, I'm just wondering, do they offer counseling to men and the women? And if they do, you know, and I'm just wondering, do they have it and it's together? And I can imagine them having a session with just the women. But do you know anything about that? He was mentioning that he does something, and I forget the gentleman's name that was there, but he does some counseling with people and put on with the counseling of people for that. And they encourage women to come with the men, because the communication that you got to have with your partner is, you know, and too many things are straining our families as well. So another thing that we don't talk about, communication is one of them. One of the things we don't talk about is our health, and these things that if somebody care for you and love you, I'm sure they're going to be there to support you. But again, as I stated before, Jill was talking about the suicide, we tend to hide it because we don't want to see vulnerable. And Doc V, I pray nothing happens, but you always speak about how your dad is this proud man, he's this manly man, and I'm sure at one point in time, if something happened, if you were younger, he wouldn't let you see it. I know with his age and his maturity and his knowledge now, but there was one time your dad suffered something, he didn't let you see it, and we all go through that. So with men with cancer, it's a lot of shame that we got to get over. We got to stop, you know, being shameful. We got to stop being prideful, and we got to embrace these things, because we're losing ourselves by, you know, keeping it to ourselves. And it's interesting that you said it's a lot of shame, because I'm wondering what else could it be. So if it's not shame, what else do you think it could be?
I think it could be that they don't want to deal with it directly.
Or, you know, I could see that, but I'm also thinking that they don't want to make the family sad.
Put a burden on it.
Yeah, they don't want to be a burden.
Yes.
So that's kind of what I'm thinking. And from my dad's perspective, knowing the type of man that he is, that would be his reason.
He don't want a burden.
You know, and so I can't help but think about Chadwick. For those that don't know who that is.
Yeah.
The Black Panther. But
Jackie Robinson.
Right. Yes. I can't help but think about this man being able to endure everything that he was going through with all the testing, etc., and yet still keep functioning and people not know.
Right.
You know, even on set, you know, whatever he had to do to man up and to keep going, he did that. And so I'm thinking maybe his was didn't want to be a burden, didn't want to be treated differently or something like that. So, yeah.
And you mentioned the burden. So another number that was interesting, 1 in 5 men with prostate cancer specifically experience long-term anxiety and depression. 72% of those men that are impacted will never seek any kind of help. So if you're not seeking help for how you're feeling, if you're not talking to your family because you don't want to burden them, if you're not talking to your friends because you're embarrassed to talk about it, if you're not using anything for an outlet, there are studies that show alcohol use drug abuse, pain medication, using these outlets that are unhealthy. So as you say, with men not wanting to speak about it, and you can see that difference, because I know women right now who are very open on, let's say, social media about their cancer diagnosis. They'll talk about it, other women will chime in.
Yeah.
Not very often do you see a man speak of it and then have a conversation openly, unless it's posted by his wife or even then, men don't put it out there like women do. And there's a huge difference.
And I agree with that, but I'm just wondering this, because the beauty salon is a place where this topic comes up. Women will talk about this freely. And obviously, hairstylists, you're dealing with the hair and the things that's going to happen after that. So with men, I'm wondering, because they could obviously lose their hair too, going through the process, the treatments. So I'm thinking that the barbershop would be a good place, a comfortable place to talk about it. What do you think, and do you still feel like there's a sense of shame that it's going to stay dormant?
I'm going to be honest, as a man, when it comes to our health, that's the last thing we talk about in the barbershop. Let's be honest. That's the last thing we talk about, period.
Okay.
So if it's coming to this detriment, of a cancer, I know we're not going to talk about that. And we spoke about that. But these are places we should feel comfortable because we're among brethren. You never know who's going to, going through the same thing that we'll be able to talk about this. But too many times, because and we talked about the colorectal cancer, because the evasiveness to us as men of going through the testing and trying to find it, that just doesn't play well with your psychological and your things
so
like
you're
that.
embarrassed.
You're embarrassed. You had to go get that
so
test.
So it's like, you don't even want to discuss that. We have to get this. You don't want to tell nobody you just went and got that test. And you make me think about, I was listening to Steve Harvey and I believe nephew Tommy, and they were having a conversation, and it was about that.
Right.
And they were kind of making fun, but then they got serious for a minute. But then Tommy, because he was going to have the colonoscopy, he was making fun of himself and that he had to go through the process. So you're right. And I can see you saying that, because they did, make a lot of jokes about it. But I think men make the jokes themselves to kind of ease the thought of what's actually happening to them.
Even when the guys, when we had our production meeting that night, the guys were talking about it openly, and there were some jokes, back and forth. And, that is sometimes, people who are funny are usually depressed, statistically. Like some of the best comedians, they're funny to overcompensate for what's going on inside. People do that too when something's uncomfortable. When we get uncomfortable or nervous, we laugh, because that's how we deal with it. So watching grown men talk about something that grown men don't talk about was super cool, and we weren't even on air. That's just what they were doing, which is what needs to be done. And there was some laughter, to make it more comfortable. It doesn't take away the seriousness of it, but it makes it so we can have discussions that are needed.
Yes.
But and to prevent all of this or getting further down, because there's a lot of other cancers that affect men, but again, we just don't talk about it. Melanoma, that's skin cancer. Unfortunately, my grandmother passed from that, but we're out in the sun. We as black people are out in the sun, and we don't think that we need sunscreen or anything like that. But
have it.
You gotta have it, because the sun and the UV rays, if it's just a light one, again, you should know by your skin tone and what you need, but you do need something because the sun is just beaming down on you. Eric ain't here because he would get a kick out of this one, and he would probably throw it at our cameraman, but I'm going to say it gently. Fair skin black men extrally need to, watch how they stay out in the sun.
Extrally. We like that word. Here at Neutral Voices, we might make up some more. No.
Yeah, I know.
Extrally. We like that word, though.
Extrally. Heavens.
I actually said that. Like that. Extrally.
Extrally's not a word.
I know that, yeah. I understand that. I speak English.
We're going to carry on.
But no,
in case you're just tuning in, this is Neutral Voices, and we are talking about me and cancer, and we're trying to make it
just having fun.
Yes,
but no,
lighten it up a little bit.
As black person, you got to know your skin tone. You got to know, all of that. You got to know your skin texture. And I know a lot of us don't know that, but it helps, especially with melanoma, because you would know what kind of sun guard you would need. But, fair-skinned people, even black people with freckles, your skin is still fair. So you have to cover up, and you have to make sure these. And men, we out in the sun, too, cutting grass, fixing cars. Some of us do construction. We're not thinking about putting on sunscreen.
Yeah. That's right. And even when the sun is not bright, you still need sunscreen, because some people think if it's going to be, a haze and cloudy, I don't need sunscreen, but you still need sunscreen.
Right.
My mama always told me, because when I was younger and liked to lay in the sun, I wouldn't lay out when it was cloudy, and she was like, no, that means the sun has to work harder to peek through the clouds, so it's stronger that way. I don't know if it's true or not, but I always got a really good tan.
I don't know either.
Tan with the clouds out.
But you still can. Now, see, you mentioned, you said you were talking about adult men, grown men, etc., and so then you start talking about melanoma. Mm-hmm. I was going to ask you about young boys.
Same thing.
The different types of cancers. What are some of the main cancers that they get, and at what age?
Well, it's a rare occasion for young boys, but young boys can, develop testicular cancer at a young age. It's a rare occasion, but it is, and that would be hard because they're not going to know what's going on. They haven't hit puberty, so things going that
already
would be hard.
Shy and don't really want to call on mom to come look or see or feel
don't
or just and
it depends on what age it is. They say as young as rare cases as young as 7, because that's when your testes begin to fully develop. They're not fully developed, but that's when they're going into their gestational stages and they're going into their full development. Okay. So as young as 7, rare cases, very rare cases, but it can happen. And again, like you say, you don't know what's going on in your body. Think about it if you get it at 15. You're going through puberty and all of this. You think it's just something normal, but it could be something totally different than what it is. Melanoma is something, and young men out playing sports, like you got basketball. We take our shirts off in the summertime. We playing basketball, and again, we're not covering up. And then there's we all see the commercials and we all understand them, that you may get it as a young person or come in contact with it as a young person, but it might not develop until you're older, and that's the HPV. The human papillomavirus, that is a reproductive cancer. It can go to testicular cancer, urethral cancer, colon cancer, testicular cancer, prostate cancer. It can go, and for women, it can go to uterine. Cervical and all those cancers, because it's a reproductive cancer. But those are one things, and Mr. Harris did say things you do in your youth could affect you later on in life. Yeah, so
your lifestyle, so way back then. So just before you leave that, so the hippolyoma, did that just come out of nowhere? I mean, I'll say for myself, look how many years you have lived.
Yeah.
And it's like, this just popped up, right? So this is something that's been obviously going on, and they just found out because of research.
Yes, it had to be research.
I remember when Macy was younger, it was just they had to get a vaccine for it because it was very common. Usually it goes by the HPV instead of the human papilloma because everybody has a hard time saying that. So I remember they would always talk about HPV and how the vaccine was important because it could develop into cancer. So this is something that is actually very common, especially more in young girls or women who are sexually active, basically.
Right.
So there's a vaccine for it now. They treat it just like they would an STD back then. It is serious.
Yeah. So I just want to bring that to, that I had never heard of it, and then all of a sudden, here it is. Okay, so that was about the young boys. So you also wanted to talk about the lifestyle and the different risk factors connected to men and cancer.
Yes, number one, and smoking is really carcinogenic. Everything that comes in all those chemicals.
And would you say secondhand smoking?
Secondhand smoking, that's why they, banned it in most places. But think about it, and I didn't think about it till I went to the seminar. When you smoke, you think lung cancer. It's just going to resonate in your lungs. But those chemicals go throughout your whole body. and those chemicals can affect your cell structure. Those chemicals affect everything in you. So cancer can affect the cell in a whole nother area of your body, and that's where you can get the cancer. So smoking is one thing we gotta stop.
And before you leave that, I saw a commercial. This is one of the most recent commercials when they're talking about smoking, and the lady says, I think they are showing her foot, and half of her foot is cut off, and so she begins to tell you the story, and it actually comes from smoking. So when you're talking about the destruction of the cells, then that's what, that was.
Alcohol, illicit drugs, even some prescription drugs, because they counteract or they're fighting one thing, but they're also destroying something else. So you got to be careful, with the even prescription drugs you're taking, because it could be, and again, side effects are, things that they've seen. They're not all that's going to happen, but there are all possibilities that can happen. So you got to make sure you're taking the right drugs with the right, prescription drugs, but, illicit drugs and, diet.
Yeah.
And here's one thing that's too. Being sedentary, when you just sit down, you're not moving, you're not exercising.
I was going to say, so you went to the diet, so I thought you was going to get into some of the foods.
I'm going to get into the foods.
Okay, and then so you're in the exercise zone right now?
Yes.
Okay.
Because it's something that we take for granted. We sit at a desk all day, every day. A lot of us. I know I do. I don't know, but you're on your feet.
I'm moving.
I don't know if you sit at a desk, but I sit at a desk and a lot of people sit at desks most of the day. But then when we go home, what are we doing? We're gonna sit on the couch, watch TV.
Clarence, you sit at a desk all day?
Yes.
Then can I recommend the desk that you can raise up and you can stand?
I get up and move as much as I can.
Okay, I'm just saying because that's why they came out with that. So I just wanted to say that to you or to people that sit at desk all day that. They came up with something, and you can actually let it up and down, and that way you can get out of the chair. Yeah. And so back to that. So exercising, you're saying, so part of the lifestyle is that we're sitting down all the time. We're not moving. We're sitting in front of the couch, and now we are flipping.
Right.
We're not even getting up to change the change the TV.
Your blood to flowing and your body to processing things and things like that. And that goes with the diet. We're always quick eating.
Okay.
We're going to leave here. I ain't eating all day, so I'm going to quickly grab something. I'm going to quickly grab something. And all the stuff that we grab quickly is not nutritious or healthy for us. So, but if you eat a lot of fruits and vegetables and green leafy vegetables, real green leafy vegetables, and Mr. Air said this last night, kale and seaweed, those are superfoods. You eat a lot of that, and
would that be spinach too, huh?
Spinach too? Yeah, just green leafy vegetables. Okay. A lot of citrus, a lot of berries. Because they have antioxidants in it, things like that. And another thing is if you drink alkaline water, if you can alkaline your body, that helps as well. So it's simple things in our life that we can do, but we just don't do them.
And I was just going to say that I think right now there's so much information out there that if every person, as long as they have like a TV or access to books or social media, they know what they can do to prevent these things. The exercise, the eating, the things like that. We just don't do it.
Kind of like somebody said, I don't need to hear another sermon, right?
Because I already know.
Because I already know what I'm supposed to be doing.
Right. But we're going to keep reiterating
to live right, to be righteous. And it's the same way with our health. We already know what we should do. But with that being said, so you just named some good stuff. You were talking about the different vegetables. You said berries.
Berries, yes.
And so that would be any berry, all
raspberries,
berries,
blueberries. The darker the berries.
The darker the berry.
That goes with two things, but that's true.
I was going to say, is that true with our health?
They have the more antioxidants in it. So that the darker the berry, yes.
So that's what we're going for, the antioxidants.
Yes.
And then we want the oily fish.
Yes.
We always want the oily fish.
Yes.
Oily fish.
Yeah, cod.
I didn't know cod was in the category. I know sardines.
I eat
sardines. Mackerel.
That's the only fish I don't eat is sardines.
That's not a fish. That's an alien.
Salmon.
Sardine. Those aren't
salmon. Yeah, I eat salmon. I eat mackerel. I eat all of that.
Good.
Yeah.
So those have the high in omega.
Yes. Omega 3s.
Omega 3s.
Yeah.
Other great things. Avocado. Do y'all like avocado?
I don't.
I was just getting ready to say, tell me a good way to. Okay.
I don't mess with avocado at all.
We got to figure out a way to get that avocado in.
No.
I think we can get it in with a smoothie. I don't know.
These are not supposed to be green. I will not. I will not.
We got to figure out a way to get that in because it's good for us.
Yes.
And as far as the potassium, the fiber, and also antioxidant, and then garlic. Y'all hear
Garlic,
people say
yes.
garlic is great for everything,
Yes.
right? So, we want to keep those arteries and our blood
Yes.
flowing good, circulation. And so Greek yogurt has some good benefits and pomegranate juice. I recently started drinking that.
Yeah, I drink pomegranate.
Pomegranate.
Yes.
I dare you to mix it with beet juice. Yeah, it tastes exactly like that.
She dares you.
Yeah.
I double dare.
So listen, we have been having great conversation all month
Yes.
about cancer, and I believe it was great to finalize it with men and cancer, especially talking about Joe Ayers and the different events that he has been having in the community and will continue to have. So if you have not been a part of that, you might want to check out Joe Ayers. Ayers Communication?
Yes, he said contact him on Facebook.
Yes.
You'll get him.
Always an amazing event, helping our men in our community. And it's time for us to get out of here.
Yes.
And guess what, y'all? I got a birthday celebration.
Yeah, happy birthday, Doc V.
Yes.
I'm
Thank
glad.
you. And before we leave, as we always say, he is not here.
He's not here.
And together?
Happy birthday, Veronica.
That
And
is
always
not
protect
what
your
we-
mind and your mind and your mind and your mind. Good night.
Good night.
Protect your mind. Thank you.